And one particular application that you brought up, Naren, was, recently I was asked by one of my clients, I'm on the journey to drop PPO plans in my practice. And I'm thinking I want to go all the way. I want to go all the way to fee for service. We're still working on that, exact process in his practice, but we're working on becoming fee for service. And he's a very analytical dentist, like many dentists are. On the DISC scale, he's a high C. He's an engineer, the engineer personality. He said, I'm trying to forecast how many patients I might lose when I drop these plans. And it's an inexact science to forecast that because you don't know. But it occurred to me that perhaps we could look at categories of patients and use that as a way to provide some kind of a forecast on who might stay and who might go. So let's use the A, B, and C categories. And let me spend a few minutes talking about the kind of patients that would be in each category. Let's go ahead and start with the A's. So your A patients would be those, I'll use some descriptives here. They're the patients that show up to their appointments on time. They reappoint for their next hygiene appointment. They pay their bills. They respond to your treatment recommendations. They follow your home care instructions. They are likely to be patients that refer others into your practice. And they're likely patients that have written 5-star reviews on Google or other platforms, singing your praises. They are our bluebird patients. That was another term I heard described many years ago from Dr. Pankey. They're our bluebird patients. They're the ones that we just love to see. We see their name on the schedule, and we know we're going to have a good day when we see them. The truth is, we wish all of our patients were A patients. But I've not met a practice where every patient is an A patient. I've yet to meet that in my experience. We wish they were all A patients. Is there anything else you would add to that category of A patients, Naren, with your experience working with dentists?
Yeah, I think the other thing I want to add is, like you touched on DISC, right? So a way a person with high D might behave might be different from, let's say, a way a person with low D but high S and C behaves. So just because somebody is not gregarious or friendly or gives you a hug doesn't mean they're not an A patient. So how do you kind of navigate that? Because, sometimes you can't judge a book by the cover.
Yeah. Well, they may not, if they have a low I, they may not be social, outgoing, gregarious type of patients, but you're going to watch their behavior. They show up on time. Mm-hmm. They keep their appointments. They are in your schedule in the future because they value dentistry. And that's another thing. They value what you do for them. The
Right.
A patients value what you do for them.